Urinary incontinence is the involuntary leakage of urine. This condition is normally prevalent in elderly adults, impacting both health and quality of life, but it can impact younger adults as well. Mayo Clinic in the United States has stated that urinary incontinence is prevalent in at least 50% of adult women. According to the British Association of Urological Surgeons, International Society of Urology, it is estimated that 423 million people 20 years of age or older worldwide experience some form of urinary incontinence. Now, there are a series of tests that can be done along with a thorough patient history your doctor or nurse practitioner can do to help you determine if you have urinary incontinence. They should ask you about what medications you're currently taking, what type of work you do for a living, how many children you have had, and whether or not you've delivered vaginally or by C-section. If you aren't seeing an OB-GYN or urology specialist or even a physical therapist, you may very well need to see one. Don't be fearful about getting help. Before we dive into the different types of urinary incontinence, I'd like to briefly go over the anatomy of the pelvic floor or pelvic floor muscles that run from the pubic bone all the way back to the tailbone, and they help to support your bladder, your uterus, your intestines. Strong pelvic floor muscles help hold the urethra in place as well, and they keep urine inside the bladder. The urinary sphincter muscle helps control the flow of urine from the bladder into the urethra. So when these are weakened, then a person experiences a type of stress to their urinary system. Now, the management of urinary incontinence depends on which type of incontinence that is present and the severity of the symptoms. So let me jump into the 5 types of urinary incontinence. So the first one is stress urinary incontinence. The second is urge urinary incontinence. The third is mixed urinary incontinence. So this is a mixture of stress plus urge urinary incontinence. Now, there's also overflow urinary incontinence and functional urinary incontinence. For today's video, I'll provide more nuanced details on stress and urge urinary incontinence, since they are by far the most commonly experienced in women, especially young women. And then I'll leave a high-level definition of overflow and functional urinary incontinence in the description of this video. So let's start out with stress urinary incontinence. This is the involuntary leakage of urine that occurs with increased intra-abdominal pressure. So this happens when you pick up your babies or your toddlers, or you're exercising with weights, you sneeze, cough, or laugh. This can happen because the pelvic floor weakness or sphincter muscles are also weak. Most of the time, young female athletes experience this type of incontinence, and then also pregnant women or women who have experienced multiple childbirths or even one childbirth may be prone to stress urinary incontinence, as well as women who are in menopause. So let's talk about treatment. First line or conservative treatment involves strengthening the pelvic floor muscles. You may have heard of a term called Kegel or floor muscle exercises, and this is a good place to start, especially for women who may have had large babies or have weakened perineal areas. Experts also advise weight loss, because when you lose weight, there is less weight pushing down on the pelvic floor muscles and bladder. There are also vaginal pessaries. They are soft and removable devices that fit into the vagina and provide support to vaginal tissues displaced by pelvic organ prolapse. This happens when the bladder, rectum, uterus drops or bulges down towards the vagina, and this can happen especially after multiple childbirths. Now, there is surgical management, which is the insertion of a sling to hold everything up. It's not first-line treatment because risks do come with the surgery. Now let's talk about urge urinary incontinence. This is the involuntary leakage of urine whereby you have a sense of urgency or urinary urgency due to bladder muscle overactivity. So this is also called overactive bladder. The contractions may be caused by bladder irritation or loss of neurological control. Sometimes there is no trigger warning at all. You may not make it to the bathroom on time because of the overactive bladder. This can happen when there is nerve damage to the bladder or spinal cord damage, for example, or even a urinary tract infection. So let's talk about some treatments. Some of the things you can do include going to the bathroom more often and on a set schedule, being mindful and concentrating and squeezing those pelvic floor muscles as well. So this is when you perform those Kegel exercises that I mentioned earlier. Some experts recommend you avoid caffeine if you consume it and see how this helps you. Then there are medications. So first line being the antimuscarinics, and these drugs treat overactive bladder or OAB. These drugs include oxybutynin, tolterodine, phenylephrine, trospium, and the primary way these drugs work is by relaxing the smooth muscles of the bladder. To be more specific, let's talk about oxybutynin chloride, extended release tablets. They are indicated for the treatment of overactive bladder with symptoms of urge urinary incontinence, urgency, and frequency. They are also indicated for the treatment of pediatric patients aged 6 years of age and older with symptoms of detrusor overactivity associated with some type of neurological condition such as spina bifida. If you have any of the following conditions, you should not take an antimuscarinic or an muscarinic antagonist. So that includes urinary retention, gastric retention, uncontrolled narrow angle glaucoma, and any known hypersensitivity to oxybutynin chloride extended release tablets or any component of oxybutynin. Some medical providers also treat urge urinary incontinence with nerve stimulation or sacral nerve stimulation. So during this operation, your doctor puts a pacemaker-like device in your back at the base of your spine. That's the site of your sacral nerve, which carries signals between your bladder, spinal cord, and brain that tell you when you need to urinate. But again, this is not first-line treatment. If you experience urinary incontinence and you haven't yet seen a provider, I urge you to seek one out. Until then, start by doing Kegel exercises. I've had children and I've done them before and they are very helpful. So, please also do your research on whether medications that treat overactive bladder may be a viable option for you. I do hope this information in the video has been beneficial for you and has helped prepare you for when you go to see your healthcare provider or your physical therapist to ensure that you are getting the proper treatment necessary. Thank you for watching and see you in the next video.